Good morning. Good morning, everyone. We request everyone to put your mobile phones on silent mode, please. Thank you. A very good morning to one and all present here. We welcome our esteemed dignitaries to join us on the dais. Our chairman, Dr. Nalaji Palaniswamy, Executive Director, Dr. Arun N. Palaniswamy, Chief Guest, Dr. Vivek Pathak, Consultant Nephrologist, KMCH Main Center, Dean, Major General Dr. R. Ravi Kumar, Dean Academics, Dr. Sridhar, Medical Superintendent Dr. Ram Kumar Sir, and Vice Principal Dr. Jeevithan.
With great joy and immense pleasure, we wish to extend a warm welcome to all the dignitaries, HODs of all the departments and the students, the stars of today. It's a moment of great privilege for us to organize this memorable event, the White Coat Ceremony 2025 batch of Kmch Ihsr. And the ceremony is being live streamed so that family and friends could be a part of the festivities. To emphasize the more scientific approach to modern medicine, physicians sought to wear the most recognizable symbol, the white coat. White coat ceremony is a way to emphasize humanism and commitment to serve the society. Not all angels have wings. Some have stethoscopes too. We congratulate and wish all the budding aspirants of medical profession a glorious career ahead and be the channels of God's healing touch.
Prayer is the beginning, the core, and the goal of all peacemaking. Please rise up for the Tamil Thai Valtu.
We are glad to welcome our Dean, Major General Dr. Ravi Kumar, who has spent 37 glorious years in serving the armed forces as a senior consultant in radio diagnosis and interventional radiology. Sir was awarded with Ati Vishishta Seva Medal by the Honorable President of India for his distinguished service in public health management of the Indian Army. We are glad to invite him to deliver the welcome address.
Good morning, everyone. At the outset, on behalf of Chairman, Board of Directors, I welcome all parents on this momentous occasion, which is a milestone achievement both for you, parents and students. It is my proud privilege to welcome our chief guest, none other than a role model, Dr. Vivek Pathak, an ace nephrologist who has been an initiator of renal transplant in KMCH 30 years ago and also started the steroid-free transplant in this part of the world. I'm sure when he is being introduced, you'll get to know what a legendary role he has played and is still playing. We welcome our beloved chairman, Dr. Nalaji Palaniswamy sir, a medical leader, come ace administrator with great vision, who provides everything, and he has guided us to achieve academic excellence and the very reason we are here today. We thank our Vice Chairman in absentia, Dr. Thavamani Palaniswamy Madam, for her blessings and personal message to me, wishing the new entrants a bright start. I also welcome our dynamic Executive Director, Dr. Arun Palaniswamy, who enables all our requirements without any second thought. Thank you, sir. Now, to our students, I welcome the class of 2025. It gives us immense joy to welcome you. It is a pride movement. to welcome you to the MBBS program and to this profound milestone, your white coat ceremony. Today, as you don the white coat for the first time, you step into a noble tradition of compassion, precision, integrity, and lifelong learning. This coat is not just a garment, it is a symbol of trust that the society places in you, a reminder of the responsibility you will now carry on and a promise you make to serve with empathy and excellence. As you begin this journey, remember that medicine is much more than a profession. It is a calling from within. There will be long nights, challenging exams, difficult cases, moments of doubt, confusion, and achieving clarity thereafter. But there will also be an extraordinary fulfillment in this journey. The first time a patient smiles because of your effort, you have achieved everything. Your first diagnosis you get right, the first life you have helped change. Let curiosity be your compass, compassion your constant companion, humility your greatest strength. Learn from your teachers, your peers, and most importantly, your patients. Every chapter in this journey will shape you not just into a doctor, but into a better human being. Training as a team will bring you batch spirit. You all have come from different walks of life, from different culture, but you will sail on the same boat for the next 5.5 years. The batch spirit which you will invest now will reap the camaraderie lifelong. May you wear this white coat with honor, courage, and kindness today and always. And welcome to the world of medicine. And your journey begins now. God bless the batch of 2025. Jai Hind.
Thank you, sir. Light is the symbol of brightness and auspiciousness, as it brings prosperity and happiness in all our lives. Light, the Agni, shows everyone how to rise upwards and dispel darkness. We are pleased to invite our dignitaries to on the dais to light the ceremonial lamp.
Four girls from 2025 batch, please come to the dais. Thank you, sirs. we gladly invite our Dean Sir to honor and felicitate our Chairman, Dr. Nalaji Palaniswamy Sir. Thank you, sir. May I request our Dean Sir to present a bouquet to our Executive Director, Dr. Arun Palaniswamy Sir, as a token of our respect and gratitude. Thank you, sir. We gladly invite our Dean Sir to honor and felicitate our Chief Guest, Dr. Vivek Pathak. Thank you, sir.
Now, we request our Chairman, sir, to felicitate our Honorable Chief Guest, Dr. Vivek Pathak, sir. Let's begin the ceremony of white coat presentation now. Students of roll number 1 to 8, please come and stand near the dais. We request our chief guest, Dr. Vivek Pathak, sir, to present the white coat to our medical students.
Adarsh. Adya Bisht. Aishwarya. Aishwarya, yes. Akash M. Akash P. Akilandeshwari V. Akshaya Suresh. Akshita Shri KS. Archita yes. Arnika JK. Arun TA. Avantiha Sridhar. Bhuvadashini G. Dikshita G. Dhanushika Vijay Kumar. Dharani Roja Balamurugan. Darshadini GB. Darshini R. Digesh V.
Thank you, sir. We now request our chairman, sir, to present the white coat to our medical students.
Divya Bharati Navanitha Krishnan. Divya Dashini K. Divya Prakash KM. Divya Shri Satish Babu. Dressen Samuel Davis Jayakumar.
Thank you, sir. We now request our Executive Director to present the white coats to our medical students.
Isha P. Ethan Bandari V. Gautam Siddharth Vimal Kant. Gayatri Ganesh. Girish Kumar Satyanarayanan. Gomati R. Guru Prasad RP. Harivatsha P. Hariharan Muthukumar. Harini BR. Harini C. Harini Sai Shri Narasimhan. Harini K. Inba Inian Yes. Inia Senthil Kumar. Jaifan J. Janani B. Jasmine Roja HS. Jayashruti T. Jayesh R. Jeffrin Timothy J. Jesus Grace R. Joel Jibu T. Josh Krishna SM. Kmch Ihsr. Kanishka ST. Kanishkar Yes. Karina Dubey. Kartikeyan PS. Kavin Siddharth RS. Kavya G. Kirtana M. Kirtana R. Kirtana Vijayanand Jayanti. Kirti Kumar R. Kishore M.
Thank you, sir. We now request our Dean, sir, to present the white coat to our medical students.
Kausavi KM. Lakshana V. Lekshant M. Loganayagi M. Lokeshwari G. Madan VV. Madhumita MK. Mahashweta L. Malavika Verma. Manikandan M, Meha R, Mitusha Damodaran, Muhammad Fadil Abdul Karim, Monisha V, Mullai Sara L, Nandagopal D, Nandida B, Neha S, Neha Suresh, Nikita Shri S, Nishant Srinivasan, Nityashri R, Nitish D, Pavan Kalyan SM,
Thank you, sir. We now request our Dean Academic, sir, to present the white coats to our medical students.
Pooja MS, Pratiksha Anjana S, Prabhushankar T, Pradeepa V, Prakriti B, Prati R, Pratishta PE, Pratichna VP, Pravanya S, Preetika Ramu. Priyanka yes. Priyasha yes. Priyashni yes. Raghav Jawar. Raghavan SS. Rajashri yes. Reenu TA. Revati yes. Rishika M. Rishivant Shakti.
Thank you, sir. We now request our medical superintendent, sir, to present the white coat to our medical students.
Safa Aisha H. Sahana Shri RB. Sahiti Shankar M. Sai Charan J. Sam Jeba Kumar J. Sanjana T. Sanjana V. Sangamitra S. Santan Sai Valamudi. Saravanan V. Sasikumar CP. Satvika Vinakota. Selvapriya M. Setulalita S. Sadhana MP. Shamita R. Shanmugapriya B. Sheikh Abdul Rahim F. Shivani SV. Sriniti V. Shriya Priyadashini Behra. Shruti Senthil Kumar. Shweta T. Sirish Yagav Vimal. Shivaranjini V.
Thank you, sir. We now request our Vice Principal, sir, to present the white coat to our medical students.
Sneha M. Sriharidra S. Sri Sheila M. Sri Adarsh LK. Srinidhi S. Sudaish SS. Sumitra. Sudarshan S. Suvan Sundar P. Shweta S. Tanusha Chandramohan. Tarun Karthik K. Tanusha Fatih. Vijayta Prasad. Vishwa I. Yashika G. Yuvan Shankar M.
Thank you, sirs. A doctor's white coat has long been the widely recognized symbol of the medical profession, depicting its purity. White coat is placed on each student's shoulder along with responsibility to maintain the standards of professionalism, dignity, discipline, and decorum.
We request our Dean Academics, Dr. Kmch Ihsr, sir, the man of principles, to administer the Hippocratic Oath to our students. Students, please get up.
Yeah. So this is the modified Hippocratic Oath with elements of Charak Shapat also included as per the NMC norms. This is an occasion for all of you to commit yourselves to the principles of justice, ethics, service, empathy, and all that a doctor is known for. He is treated as a demigod in society. So I'm sure you will all live up to the expectations of society at large. So with the permission of the chair, I would be reading out the oath that you have to take. So hands across. I would read it slowly. I'm sure you would take it with all sincerity. As a member of the medical profession, during the period of study, I shall live a disciplined life with my teachers and peers. I will give to my teachers and colleagues the respect and gratitude that is their due. I shall aim my full efforts and ability towards the desired goal of my profession. I would dress up in a decent and impressive manner that would inspire confidence in my patients. My conduct shall always be appropriate, pleasant, truthful, beneficial, and polite. I solemnly pledge to use my knowledge for the welfare of mankind. I will respect the autonomy and dignity of my patient. I will not permit considerations of age, disease, or disability, creed, ethnic origin, gender, nationality, political affiliation, race, sexual orientation, social standing, or any other factor to intervene between my duty and my patient. I shall not harm any patient for the sake of monetary or selfish gains, nor shall I entertain a desire for lust, greed, or wealth. I will foster the honor and noble traditions of the medical profession. I will constantly endeavor to update my knowledge for the betterment of my patients. I will attend to my own health, well-being, and abilities in order to provide care of the highest standards. I will not use my medical knowledge to violate human rights and civil liberties, even under threat. I make these promises solemnly, freely, and upon my honor. Thank you. You may all be seated. I hope you will be able to live by this oath in letter and spirit. Even as the students settle down in their seats, may I request the dignitaries, faculty members, consultants, administrators, guardians, seniors present here to rise from their seats and welcome, greet, and bless the young medicos. Can we have a round of applause for them? Thank you very much. Please be seated. Thank you and congratulations to the young medicos.
Thank you, sir. We are glad to welcome our Executive Director, Dr. Arun N. Palniswamy, to address the gathering. He has an extensive experience in hospital administration and focuses on elevating patient care while also supporting education and training for the next generation of healthcare professionals. He was conferred with the Multi-Billionaire Business Achievement Award in August 2024 for making KMCH a leader in multi-organ transplants. He has also received Best Managed Companies Jury Special Recognition Award in October 2025. Under his dynamic leadership, KMCH continues to march ahead and ensure quality healthcare for all. Over to you, sir.
Good morning, students, parents, various faculty. I'm glad to be here today to welcome you into the ranks of early first stage of doctorhood. Only 5.5 years to go. But there's a lot of advice you'll be getting over the years. A lot of things. Whatever you do in life, you should do it with passion. I don't know how many of you, just for a break, I don't know how many of you actually participated in the marathon on Sunday. Not that we're forcing you, but so if you had participated, you would have done 16 kilometers over 3 hours, and you would have remembered it for the rest of your life. If you didn't do anything, you would have woke up happily and ate idli, and you would have forgotten it and not remembered anything. It would just be any other Sunday. So there's only a certain amount of advice that we can give. Just yesterday, I had seeing the new people joining our hospital from various employee ranks. We have a lot of pharmacists who had gone into medical coding, that means medical billing, and they'll type out transcripts. And they're quitting their jobs because AI is taking over their jobs. Then I also asked our HR, where's all our new graduates? I don't see them. I'm seeing other people. They're saying they're all going for billing and coding. They're all doing medical transcription because that's where the salary is the highest they're giving to fresh graduates. Whatever you like, you should do it with passion. I mean, I can't tell you where your career will go in the age of AI. I can't promise you a lot of things, but you should be passionate about it. It won't start off with a big bang. I think our chief guest today, Dr. Vivek Pathak, I've known him for almost 35 years. When Kmch first started, I used to live in the guest house, actually. I came here in 7th standard. I used to live on the campus. Pathik had joined, I think, almost a year later. He's from Indore. Somehow he managed his way to Coimbatore. I think he said at the time that, chairman is looking for foreign graduates, but I don't know if he'll take me. So he joined KMCH all the way back then. And KMCH was not a roaring practice. Do not examine that there's lots of huge number of patients actually that was lining outside the door. At that time, I think Dr. Pathik was seeing a few patients. One of the things he did to increase and keep busy during the daytime is that I think our nephrology department used to see snake bites. And even to this day, our nephrology department sees snake bites like all the rest of India, because they were once called snake bite doctors because there was that few patients in the clinic. There was no transplants that first year, but gradually over time, I think Pathik has now done 1,500 plus transplants. He's done record number of papers and is one of India's leading nephrologists. So as I said, it didn't start off with the big bang, but it started off with the passion about what you do, and you persist at that passion, and you can achieve great things. I'll let Dr. Pathik speak for himself, but I'm glad to have you all today, and congratulations on your first steps.
Thank you, sir, for your insightful and motivating words. We are truly honored to have among us our chairman, Dr. Nalaji Palaniswamy, sir, a visionary leader who continues to inspire generations. In 1990, sir had established a KMCH Medical Center, and in 2019, Kmch Ihsr Medical College was started with excellent infrastructure and good teaching faculties. Today, we have our enthusiastic 7th batch of students with us. Our chairman, sir, is a proud recipient of an international award in 2017 for being one of the Asia's best healthcare brand. Also, the Tamil Nadu Kmch University had awarded him with a Lifetime Achievement Award in 2015, and recently he had received the Best Employer Brand Award 2025 at the Leadership Award Program, Coimbatore. May I now invite the chairman, sir, to deliver the presidential address. Over to you, sir.
எல்லோருக்கும் காலை வணக்கங்கள். இன்னைக்கு அப்பா அம்மால வந்திருக்காங்க. உங்களுக்கு நான் இங்கிலீஷ்லையும் தமிழ்லையும் கலந்து பேசுகிறேன். ஸோ அவங்களுக்கு புரிகிற மாதிரி. அதனால் இந்த ஒயிட் கோட் செரிமனிக்கு வந்து நீங்கள்லாம் உங்களுடைய ப்ரொஃபஷனல் லைஃப்பை இங்கே ஆரம்பிக்க போகிறீங்க. 150 பேர் ப்ரொஃபஷனல் லைஃப்பை ஆரம்பிக்க போகிறீங்க. இது டாக்டர் ஆகிறதுக்கு வேண்டிய தகுதி உங்களுக்கு இருக்குது. அதுக்காக தான் இந்த வெள்ளைக்கோட்டை உங்களுக்கு போட்டு கொடுத்துருக்கோம். இந்த வெள்ளைக்கோட்டு போட்டாவே நீங்கள் மற்ற ஆளுகளை விட நீங்கள் வேறு ஆள். நீங்கள் டெடிக்கேட்டட். நீங்கள் உங்களுடைய லைஃப்பை வந்து ஒரு பெரிய காரியத்துக்கு நீங்கள் வந்து சமர்ப்பிக்கிறீங்க. இது வந்து ஒரு சின்ன வேலை இல்லை, லைஃப் லாங் உடைய வேலை. நீங்கள் வந்து மற்றவங்க வேறு, நீங்கள் வேறு. உங்கள் பசங்களுக்கு சொல்கிறேன், தம்பிகளை பொண்ணுங்களை, நீங்கள் டாக்டர் நான் நினச்சிட்டிங்கன்னா உங்களுக்கு டைமு நேரம் ஆம்பளை பொம்பளைங்கிற வித்தியாசம் கிடையாது. அந்த ரிலிஜன் இந்த ரிலிஜன் எந்த ரிலிஜனும் கிடையாது. அது பணக்கார ஏழைங்கிற வித்தியாசமே கிடையாது. உங்களுக்கு ஒரே ஒருத்தர் வந்து உங்கள்கிட்ட வந்து எனக்கு உடம்பு சரியில்லைங்க அப்படிங்கிறவர் தான் உங்களுடைய ஒரே பாஸ். அவர் தான் உங்களுடைய அதிகாரி. அவங்க தான் உங்களுடைய எல்லாமே. அவங்க தான். இப்போ நீங்கள் நினைக்கிறது என்ன நினைப்பீங்கன்னு தெரியல, எப்படி டாக்டருக்கு வந்தீங்கன்னு தெரியல. இன்றைக்கிலேருந்து நீங்கள் வந்து வேற ஆள், சொசைட்டியில் வேற ஆள். நாய் பேய் மாதிரி அங்கே இங்கே அலைய முடியாது. ஜென்டிலாக கௌரவமாக ஒரு இடத்துலையும் இருக்கணும். எந்த இடத்துலையும் நீங்கள் ஒரு மெடிக்கல் ஸ்டூடெண்ட்னா ஒரு கௌரவத்தோடு எந்த இடத்துலையும் நடந்துக்கணும். ஆட்டம் பாட்டத்தில் கூட கௌரவம் வேணும். அது மாதிரி கண்ட இடத்துல போகக்கூடாது. அந்த பாரு இந்த பாரு அப்படின்னு போய் சுற்றிட்டு இருக்கக்கூடாது. நீங்கள் ஒரு டிஃப்ரெண்ட்டான ரேஸ். நீங்கள் வந்து இப்போ உங்களுக்கு தெரிய வேண்டியது, நான் ஒரு டாக்டர், நான் வந்து ஒரு என்னுடைய வேலை அந்த உடம்பு சரியில்லாத ஒரு ஆளை நான் பார்க்க போகிறேன், அவனை நான் சரி பண்ணுறேன். அவர் தான் சொல்கிறேன், என்னுடைய நாலேஜு திறமை ட்ரைனிங் அதிலெல்லாம் இருக்கிற திறமையை வச்சு நான் அந்த ஆளை குணப்படுத்த போகிறேன் அப்படிங்கிற ஒரு பெரிய மனப்பான்மையோடு தான் இருக்கணும் இனிமேல். நீங்கள் வேறு மற்றவங்க வேறு. அதனால் இந்த ஒயிட் கோட் அப்படிங்கிறது ஒரு பெரிய விஜயம். இந்த விஷயத்தில் என்ன அப்படின்னா, நீங்கள் வேறு கோட் போட்டுட்டிங்கனாவே நீங்கள் வந்து ஒரு பெரிய பெரிய மனுஷன், மனித குலத்திலேயே நீங்கள் ஒரு பெரிய ஆள். அது நான் வந்து கரெக்டாக பண்ண போகிறேன், சரியாக பண்ண போகிறேன், எந்த விதமான பாகுபாடும் இல்லை. அந்த ஓத்தில் ஹிப்போக்ரேட் ஓத்தில் சொல்கிற மாதிரி எதுவும் உங்கள் கண்ணுக்கு முன்னுக்கு தெரியக்கூடாது, ஒன்றே தெரிய வேண்டியது அந்த பேஷண்ட் தான் தெரியணும். அதில் சொத்து சுகம் பணம் அப்படிங்கிறதெல்லாம் பார்க்கக்கூடாது. அதுவும் எத்திக்கலாக ப்ராக்டிஸ் பண்ணணும். அந்த எத்திக்காலிட்டிங்கிறது, எத்திக்கு நம்ம வார்த்தைக்கு பேர், இதுக்கு இதை தான் இந்த வைத்தியம் தான் பண்ணணும், கண்ட வைத்தியமெல்லாம் பண்ணக்கூடாது அப்படிங்கிறதான். அதே அந்த வியாதிக்கு அந்த வைத்தியம் தான் பண்ணணும். அந்த மாதிரி ஒரு பெரிய ஒரு மனப்பான்மையோட உறுதியுடன் இன்றைக்கி எடுத்த உறுதி இருக்குது பாரு, அது உங்கள் லைஃப் லாங் உறுதி. ஹிப்போக்ரேட்டுங்கிறது ஒரு லைஃப் லாங் உறுதி. நீங்கள் அதை கரெக்டாக பார்க்கணும். இந்த விழாவிற்கு இந்த ஒயிட் கோட் செரிமனிக்கு நம்ம டாக்டர் பதக் வந்திருக்கார். டாக்டர் பதக்கு மத்திய பிரதேசத்தில் இண்டூர்லேருந்து வந்தவர். அவர் வந்து எம்பிபிஎஸ் எம்டி எல்லாம் படிச்சுட்டு இங்கே வந்து கிறிஸ்டியன் மெடிக்கல் காலேஜில் ஒர்க் பண்ணிவிட்டு, அப்போலோவில் ஒர்க் பண்ணிவிட்டு, அங்கே டாக்டர் எம்கே மணின்னு ஒரு பெரிய நெஃப்ராலஜி இந்தியா பூரா தெரிஞ்சவர். அந்த எம்கே மணி கீழே ஒர்க் பண்ணுவது. நம்ம உங்களுக்கு இன்னொன்று சொல்ல போனால் எம்ஜிஆரை ட்ரீட் பண்ண நெஃப்ராலஜியில் கூட ஒர்க் பண்ணவர் அவர் தான் டாக்டர் பதக். அவர் இங்கே வந்து உலகம் பூரா தெரிகிற மாதிரி ஸ்டீராய்டு ஃப்ரீ ரீனல் டிரான்ஸ்பிளான்ட் அப்படின்னு ஒரு பெரிய சகாப்தத்தை உண்டாக்கிட்டார் உலகத்திலேயே. முன்னேன்னா உங்களுக்கு இன்னொன்று சொல்கிறேன், மெடிக்கல் ஆரம்பிக்கிறதுனால உங்களுக்கு ஒன்று சொல்கிறேன். பாடியில் நம்ம உடம்பில் எது போட்டாலும் அது ஃபாரினர். அந்த ஃபாரினாக இருக்கிற போது நம்ம பாடி ரிஜெக்ட் பண்ணிடும். எந்த பொருளை போட்டாலும் வாயில் மூஞ்சியில் வர காற்றை தவிர எதை போட்டாலும் ரிஜெக்ட் பண்ணிடும். அந்த ரிஜெக்ட் பண்ணுறதில் கிட்னி போட்டால் வேறு கிட்னி அது உடம்பு ஏற்றுக்காது. அந்த ஏற்றுக்க வைக்கிறது எப்படி? அதுக்கு பேர் இம்யூனிட்டின்னு பேர். பாடியில் இருக்கிறது இம்யூனிட்டி தான், அந்த எதிர்ப்பு சக்தி. அந்த இம்யூனிட்டியை குறைச்சி அந்த கிட்னி அதுக்குள்ளே வச்சுருக்கணும். இந்த கிட்னி அதுக்குள்ளே வச்சுருக்கணும். அப்படி வச்சு ஒரு இம்யூனாலஜியில் இன்னொன்று வந்திருக்கு, அப்படி நீங்கள்லாம் படிப்பீங்க. இம்யூனோ சப்ரஷன் அப்படின்னு ஒரு மருந்தை யூஸ் பண்ணி அந்த ஸ்டீராய்டுங்கிறது கார்டிசோனு பிரெட்னிசோனுங்கிற ஸ்டீராய்டெல்லாம் நிறுத்தி போட்டு நம்ம ஊரில் முதல் ஆரம்பித்து உலகம் பூரா அவர் வந்து அந்த ஸ்டீராய்டு ஃப்ரீ டிரான்ஸ்பிளான்டில் பெரிய நிபுணர். அவர் பண்ணின டிரான்ஸ்பிளான் 20-30 வருஷம் மேலே என்ன தொந்தரமில்ல இருக்கார். அந்த மாதிரி ஒரு பெரியவர். அவர் நம்ம கூட நான் வந்த 1990 நம்ம கூட இருக்கார். அவர் வந்து உங்களுக்கு சில வார்த்தைகள் சொல்ல, அது கூட அவர் வந்து பெரிய ஃபிலாசபர். வேதங்களிலிருந்து எந்த ஃபிலாசபியும் அவருக்கு தெரியும். மெடிடேஷன் அவருடைய ஒரு பேஷன். அந்த மாதிரி பண்ணியிருக்கிற ஒரு பெரிய அறிஞர். அவர் நம்மளுக்கு கூட இருந்தே உங்களுக்கெல்லாம் ஒரு வாழ்த்துக்கள் சொல்ல போகிறாரு. இந்த ஒயிட் கோட் செரிமனியை முதல்ல 1989 சிக்காகோவில் ஆரம்பித்தாங்க. அவரே வந்து ஆர்னால்ட் கோல்ட் அப்படிங்கிறவர் அவரே கொலம்பியா யூனிவர்சிட்டி நியூயார்க்கு போயிட்டு இந்த ஒயிட் கேட் செரிமனியுடைய முக்கியத்துவத்தை அவர் உலகம் பூரா பரப்புனது அவர் தான். 1993 இந்த ஒயிட் கோட் செரிமனி எங்கள் காலத்துலலாம் கிடையாது. நான் உங்கள் மாதிரி சேர்ந்து 1961 நீங்களும் பிறந்திருக்க மாட்டீங்க. அந்த காலத்தில் பண்ண காலத்துலலாம் கிடையாது. இந்த ஒயிட் கோட் செரிமனி எல்லாம் கிடையாது. அவர் அந்த பண்ணது காரணம் என்ன விஷயம், ஒரே சின்ன விஷயம். அவர் என்னத்துக்கு பண்ணார்னா, நாமெல்லாம் அந்த வேறு மாதிரியான சமூகத்தில் வேறு மாதிரி ஆளுகும் லைஃப்பில் டெடிக்கேஷன் டு ஒன் ப்ரொஃபஷன், அது சிக்கான பேஷன்களை, அந்த சிக்கான பேஷன்களை இந்த நாம் கவனிக்கணும், ட்ரீட் பண்ணணும், அவனுக்கு சரி பண்ணணும். இந்த வைத்தியம் வந்து உங்களுக்கு தெரியும்னு நினைக்கிற பசங்களுக்கு சொல்கிறேன். இது நீங்கள் படிக்க போகிறது ஆங்கில சம்பந்தமான மருத்துவம். உலகத்தில் பல மருத்துவம் இருக்குது. சித்தா மருத்துவமும், ஆயுர்வேத மருத்துவம், யுனானி மருத்துவம், இப்படி பல மருத்துவம் இருக்கு. அதில் இந்த இங்கிலீஷ் மருத்துவம், ஆங்கில மருத்துவம் தான் எல்லாத்தோட சிறந்தது. உலகம் பூரா ஒத்துக்கிறாங்க. பிகாஸ் அதுக்கு நாலேஜோடு வைத்தியம் பண்ணுறது, சர்வீஸில் நாலேஜோடு சர்வீஸ் பண்ணுறது இந்த மருத்துவம் தான். அதனால தான் இதுக்கு நல்ல ஒரு வரவேற்பு இருக்குது. எல்லாமே உலகத்தில் முக்கால்வாசி எல்லாம் ஆங்கில மருத்துவோடு சேர்ந்தது. ஆனால் மற்ற மருத்துவமே இருக்கு. உங்களுக்கு இன்றைக்கி மட்டும் இல்லை, கோடிக்கணக்கான வருஷத்தில் மனுஷனுக்கு வியாதி வரும், அதை வைத்தியம் பண்ணியாகணும். ஒவ்வொரு ஊர்லேயும் ஒரு வைத்தியம் இருக்கும், ஒவ்வொரு ஊர்லேயும் ஒரு வைத்தியம். இது வந்து ஆங்கில மருத்துவம். இவர் இங்கிலீஷ்காரன் வந்ததுனால உலகம் பூரா பரப்பிடுச்சு. இந்த உங்களுக்கு சொல்லப்போனால் நம்ம திருவள்ளுவர் எத்தனை ஆண்டு இருந்தாருன்னு தெரியல, அத்தனை வருஷங்களுக்கு முன்னாடி இருந்தவரை அவர் 10 பாட்டை அழகாக இப்படித்தான் இருக்கணும், இப்படித்தான் மருத்துவம்னு அவரே சொல்லிப்பட்டு போயிட்டார். அந்த மாதிரி மருத்துவத்தில் நாமெல்லாம் கரெக்டாக இருக்கணும். நம்ம தொழிலை கரெக்டான அந்த சிக்கான பேஷண்ட்களை எப்படி பார்த்துக்கணும் அப்படிங்கிறதா முக்கியம். நீங்கள் உங்களதில் சில பேர் ஆங்கிலத்தில் படிச்சுட்டு வந்திருக்கீங்க, சில பேர் தமிழில் படிச்சுட்டு வந்திருக்கீங்க. இதனால் இப்போ எல்லாம் படிக்க போகிறது ஆங்கிலத்தில் தான் படிப்பீங்க. ஒன்றும் பயமும் கிடையாது. நாங்கள் படித்தது அப்படி தான். நாங்கள் வந்து தமிழ் மீடியம் படிச்சுட்டு உடனே இங்கிலீஷில் போய் படிக்க வேண்டியதாகி போச்சு. ஒரு 6 மாதம் கஷ்டமாக இருக்கும். அப்புறம் நீங்கள் தான் பெரிய நல்ல உணர்ந்த டாக்டராக இருக்குங்க. எப்படியுமே தாய்மொழியில் படிக்கிறது தான் எப்பவுமே முக்கியம். ஆனால் அவங்க இப்போ நான் பார்த்த நீங்கள் இது 7வது வருஷம், 6 வருஷத்துக்கு முன்னே வந்த பசங்களும் இருக்காங்க. அவங்க தமிழில் படித்த பசங்க இங்கிலீஷில் படித்தவங்களாம் ஈக்குவலாக இருக்காங்க, பெட்டரை கூட இருக்காங்க. அதனால் மொழிங்கிறது ஒரு பிரச்சனையே கிடையாது. அது கஷ்டப்பட்டு படிக்கணும். யூ ஹேவ் டு டெடிகேட் ஹார்ட் ஒர்க்கு, லைஃப் லாங் ஹார்ட் ஒர்க்கு. உங்களுக்கு வேலையே லைஃப் லாங் ஹார்ட் ஒர்க்கு. 24 மணி நேரம் டியூட்டி, 8 மணி நேரம், 10 மணி நேரம், 12 மணி நேரம் கிடையாது. யுவர் ஒர்க் இஸ் கண்டினியூஸ் 24 ஹவர்ஸ் டியூட்டி. 24 மணி நேரமும் நீங்கள் வேலை செய்யணும். அதே மாதிரி 7 நாள் வேலை செய்யணும், 31 நாள் 30 நாள் வேலை செய்யணும். இதில் ஒன்றும் தயக்கமே இருக்குது. நீங்கள் உங்களை லைஃப்பை டெடிகேட்டட் யுவர் செல்ஃப் ஃபார் தி பர்பஸ் ஆஃப் தி கேர் ஆஃப் தி பேஷண்ட். அட் தி எண்ட் ஆஃப் தி வே ஒன்லி பேஷண்ட். இது அருமையான இந்த விழாவில் ஒருத்தர் எழுதின வார்த்தை படிக்கிறேன். Medicine is not just about the knowledge and technical skill. The medicine is not just about knowledge and technical skill. It is about serving the humanity with dignity and empathy. இது ஒரு பெரிய இம்பார்ட்டண்டான ஒரு வார்த்தை. நீங்கள் வந்து அதை நீங்கள் உங்களுக்கு dedicate yourself in your profession for the purpose of the patient. உங்கள் அம்மா அப்பாலாம் வந்திருக்காக இன்னொரு வார்த்தை சொல்கிறேன். இங்கே எங்கள் நிறுவனங்களில் எஜுகேஷன் சொன்னால் ஆல்வேஸ் ஒரே ஒரு வார்த்தை, எஜுகேஷன் வித் டிசிப்ளின். நீ எப்படி வேணாலும் ஆட முடியாது, பாட முடியாது, இப்படி தான் ட்ரெஸ் பண்ணணும், எப்படி வேணாலும் ட்ரெஸ் பண்ண முடியாது. இங்கே இந்த கேம்பஸ் நாங்கள் சொல்கிற மாதிரி தான் இருக்கணும். உங்களுக்கு பிடிக்கலைன்னா போயிடலாம், இப்போவே போயிடலாம். அதுதான் என்னுடைய ஒரே வார்த்தை. அப்புறம் வந்து அதை பண்ணுறாங்க இதை பண்ணுறேன்னு பிடிக்கலைன்னா யார் வேணாலும் போயிடலாம். I am telling you for your father and mother, if you don't like our disciplined education, you need not keep this your boy or girl here. அது very clear. இருந்தால் இருங்க, இல்லைன்னா போயிடுங்க, ஒழுங்காக இருங்க, இருந்தால் ஒழுங்காக இருங்க. இதுதான் எங்களுடைய டிசிப்ளின். அப்புறம் வந்து அது சொன்னார் டாக்டர், அதை சொன்னார், இதுன்னு சொல்லக்கூடாது. அது மாதிரி இந்த இன்ஸ்டியூஷனை ஐ எம் வெரி பர்டிகுலர். எஜுகேஷன் வித் டிசிப்ளின். நீ ஒழுங்காக இருந்தால் தான் நீ உங்களுடைய சொசைட்டி போல ஒழுங்காக இருக்கணும். you should look good, presentable to the patient. நான் புரிஞ்சிருக்கும்னு நினைக்கிறேன். You should look good and presentable to the patient. நீ வந்து உன்னை பார்த்தா அந்த பேஷனுக்கு பிடிக்கணும். பேஷனுக்கு நீ எப்படி வேணாலும் ட்ரெஸ் பண்ணக்கூடாது, உனக்காக ட்ரெஸ் இல்லை, எங்கள் பேஷனுக்காக தான் ட்ரெஸ்ஸு. You should be presentable to the patient, presentable to the institution. இது வெரி வெரி பர்டிகுலராக இன்றைக்கி ஒயிட் கோட் செரிமனியில் சொல்லிடுறேன். அது நீங்கள் வந்து அதை பண்ணுறாரு, இதை பண்ணுறாரு, அப்படி பண்ணுறாரு, இப்படி பண்ணுறது, அப்படி கிடையாது, இப்படி தான். இதுதான் எங்களுடைய ரூல்ஸ் அண்ட் ரெகுலேஷன். அதை ஃபாலோ பண்ணிக்கங்க. ஆனால் அட் தி எண்ட் ஆஃப் தி டே நீ ஒரு நல்ல டாக்டராக, நாலேஜோட டாக்டராக, நல்ல எஜுகேட்டட் டாக்டராக, நல்ல ட்ரெயின் ஆன டாக்டராக வெளியே போகணும். At the end of the day, you should be a good doctor when you go out. அது இன்னொரு விஷயம் சொல்கிறேன், எம்பிபிஎஸ் பத்தாது. இப்போ எங்கள் பசங்கள்லாம் அமெரிக்காவில் படித்தவங்க, அவன் படிக்கிறது ப்ரீ மெடிக்கல் 18 வயசு தான் ஹை ஸ்கூல் முடிப்பான். 4 வருஷம் ப்ரீ மெடிக்கல், 4 வருஷம் படிப்பு, 8 வருஷம், 8 6 26 வயசாம். அப்புறம் கொஞ்சம் அது மேலே என்ன ப்ராக்டிஸ் போனாலும் அடுத்த 4 வருஷம் தான் 6 வருஷம், 30 32 வயசு தான் டாக்டர் ஆக முடியும் அங்கெல்லாம். இங்கே மாதிரி 24 வயசு போய் 22 வயசு டாக்டர் வந்து ஒன்றும் தெரியாத வெளியே வர்றானுங்க. உங்கள் பசங்க தெரிஞ்ச பசங்க வெளியே வரணும். அதுதான் என்னுடைய எங்கள் மெடிக்கல் காலேஜுக்கெல்லாம் நான் சொல்கிறதே எப்படி, டீச் மை ஸ்டூடெண்ட்ஸு good education, good training. At the end of the day, he should go out as a good, knowledgeable, trainable doctor to treat the patient. அதுதான் எங்களுடைய கோல். எங்கள் டாக்டருக்கெல்லாம் தெரியும், எங்கள் ப்ரொஃபஸர், லெக்சரர்ஸ், அசிஸ்டன்ட் ப்ரொஃபஸர் எல்லாத்துக்கும் இதுதான் என்னுடைய கோலு. அதுதான் பண்ணிகிட்ருக்கோம். At the end of the day, you will be also will go out with a good distinction. நீங்கள் எல்லோரும் போஸ்ட் கிராஜுவேட் போகணும். எல்லாம் போய் உனக்கு என்னென்ன வேணுங்குதே போஸ்ட் எம்பிபிஎஸ் பத்தாது. எம்பிபிஎஸ் இஸ் நத்திங். இப்போ ஒன்று அது இப்போ உங்கள் அம்மா அப்பா குழந்தைங்களை உங்களை அனுப்பலாம், உங்களை ப்ரீகேஜி எல்கேஜி மாதிரி தான் எம்பிபிஎஸ். அதனால் யூ ஹாவ் டு கோ எக்ஸ்ட்ரா. அண்ட் ஆல் பிஹாஃப் ஆஃப் அவர் சீஃப் கெஸ்ட், dean and all dignitaries on the diet and எங்களுடைய ஆசிரியர்கள் மற்றவங்களுடைய சார்பாக I wish you all the best, all the best, all the best.
Thank you, sir, for your motivating words and your continued support for the academic excellence. We are indeed privileged to have an eminent person as our chief guest today, Dr. Vivek Pathak, consultant nephrologist, Kmch Main Center. Sir had done his MBBS and MD from Devi Ahilya Medical College, Indore, and DNB from Apollo Hospital, Chennai. He is a pioneer in performing steroid-free transplant with low-dose rituximab and thyroglobulin induction since 2005. So far, Sir has performed more than 2,000 transplants and published a new treatment protocol on the membranous nephropathy, and he has also performed many ABO-incompatible kidney transplantations in India. He is an invited speaker and faculty in many national and international nephrology conferences. He is an active member in International Society of Nephrology, American Society of Nephrology, European Renal Association. His exceptional contributions shows his dedication to advancing healthcare in nephrology. We welcome you to give the chief guest address, sir.
When I look at all of you, I notice a change when I was admitted myself 48 years before. When we got into the college, you know, in India, we call it a college. In America, they call it medical school. What is the difference? In college, you educate yourself. If you do BA sociology or history, you can read yourself. But medical school is called medical school because you are spoon-fed. You know nothing. Somebody teaches you from the beginning, everything. You require training for the full 5 years. So it is no longer a college, but a school. So those days, we had fear of seniors standing and pouncing on our head. Everywhere, all over the medical college, you had to look only at your third button. When you go to the hostel, you are constantly ragged. All that has changed. You have no fear of anybody standing outside. But then today, all of you have joined here for a course which should make you successful in life. So what is success? Success is not an accident. It's an achievement. But where is success? Success is only in trying. You can try your best. Once 1987, I was standing at a railway station in Vellore, Katpadi it is called as. I had to go to my hometown for a few days leave. So second AC compartment passed. Of course, I did not have money to sit in that. I looked at that. I said, one day in my life, I will have enough money to sit in second AC. I could not afford that. The only thing I could afford was 175 rupees ticket for normal second class. So for me, success at the time was, will I be able to sit one day in the second AC? Of course, when I was in second year MBBS, I told my mother one day I'll match Americans. There is no question in my mind. I had set my goal. I had set my goal at a very high level. There's nothing short of that, nothing short of outstanding in life. So when you want to achieve success, success is only in trying. As Krishna says in Gita, you don't know the end result. You did not know 15 years back, you'll be sitting in this hall. And you don't know after 15 years, after all your success in trying, where will you be? So what is the difference when you join this course or you go to Boeing manufacturing company? First difference which will shock you is you are entering a career which is not a complete science. It is not. Medical career is 70% science and 30% art. And those people who do not understand this, they are miserable failures. Miserable failures. One patient will come with fever, he will have corona. Second will have TB. Third will have cancer. Fourth will have kidney infection. Fifth will have a pus in a joint. Sixth will have viral fever. Seventh may not have any cancer. Like this, there are innumerable causes. How will you find out? Your all tests may be negative, and yet you will not do diagnosis. And sometimes your test will be positive, yet a diagnosis will not be there. You think this patient is positive for typhoid. It will not be typhoid. It will not be. So that's why this training takes a long time to understand this art of medicine. You may mug up all the books, yet you may not be a successful doctor. And you may not read anything, definitely going to be disaster. But after reading also, you have to assimilate and convert knowledge into wisdom. And that comes by bedside experience. It cannot be gained. What doctors call a clinical sense. Either it comes or it does not come. When it comes, it has no reason. Once I was standing in dialysis room, I called my technician. I said, you will call me for this patient next half an hour. He said, why? Patient is fine. I said, tell me after half an hour. Half an hour he was dead. He was dead. I don't know. I know he'll die. His pulse was normal. His BP was normal. Everything is normal. I know he is going to drop dead. There was no reason except that I knew. So this is sixth sense which comes to you. It comes if you are dedicated to medical science. Otherwise, it never comes. So this bedside teaching which is given to you, some people get it, some people don't get it. So remember, it is not a Boeing aircraft. When you go to an aircraft company, Boeing, that's a perfect science. 2 plus 2 is 4. In your medical career, 2 plus 2 is 3. 2 plus 2 is 5, sometimes 4. Sometimes 4. So art of medicine, if you do not understand, you are not going to be a great doctor. You have to understand the art of medicine. Over a period of years, you have to under clinical judgment. So what are the qualities you should develop over a period of years to become a good doctor? First, you should have compassion for patients. Compassion means when you look at the fellow, he has not come to you for enjoying son's birthday in Taj Sheraton. He has come here to spend money because he is bitten by a snake, or he's got severe abdominal pain. He may have a ruptured appendix. He requires help. His eyes, beseeching eyes, are looking at you. What help can you be me? And at the time, if you are looking at the cricket match commentary, he will think nothing of you. Let me tell you one thing, which many doctors also don't realize. Whether patients educated or uneducated, they know what is your worth. Sometimes they may be wrong also, but they know, like you understand patients, he's a very aggressive fellow. You will tell the next doctor on duty in the night, this fellow is very aggressive, be careful. This fellow is okay, this fellow is sick. You have assessment of patients, they also have assessment of you. It does not depend on the level of education. They also know whether you are worthy of treating them or you are not worthy of treating them. So if a practice does not pick up after 5 years, there is something to be found fault with you. That means patients are not trusting you. So the patients, all irrespective of education level, they know what you are doing for them. So here the first thing is compassion. Whether you can do something for them. There is another word called empathy in English. There are two different words. Empathy means you feel his pain as yours. You know he requires help. Compassion means you do something which is required for him. But recently, how I translate this to clinical practice. I was in America last month to attend the American Society of Nephrology meeting. One of my colleagues from Kerala, I got a call. Dr. Pathak, can you come and help me? I said, what happened? Bole, I fell down and twisted my right arm and I am in agony. I am in severe pain. I thought, I'm not a hand surgeon. Why is he calling me? Anyway, I went there. I saw him sitting on a chair with 2 fire brigade people standing beside him. His hand was like this. His elbow was swollen like this. He could not lift his hand like this. He was in severe pain. So fire brigade people told me, we have examined him. They are trained for first aid, and American medical system is a bit different. That they had the first time experience of American medical system. I have not told this to chairman also. I saw him. He said, I think I require surgery. I said, first thing you require is we have to go to a hospital. So fire brigade told me, what do you want? I said, please call an ambulance. Okay, they rang up a local hospital in downtown Houston. I went to Houston. Emergency ambulance came. with one nurse, a black nurse, with rippling muscles like a world boxing champion. He lifted him like anything, like you lift a mosquito, and stretcher went inside the ambulance. I said, I'm coming. He was looking in fear. I said, don't worry, Dr. Abhi, I'm coming with you as a medical attendant. His wife was not there. His family members were not there. So I told the ambulance people, I have no choice, but I'll come happily as his medical attendant because you require some attendant in the hospital anyhow. So I went to the hospital along with him, to St. Joseph Hospital emergency. This was the first time I was entering American hospital in my life. I showed my badge that this is my name and I'm attending the American Society of Nephrology meeting. And he is also a nephrologist from India. So one fellow came. He started talking. I said, you must be a Malayali. He said, how do you know? I said, your tongue. The way you are talking, you must be a Malayali. He said, I am. And though he had spent his childhood in Kerala, he took the history. And then one chief nurse came. She took the history. And then this physician's assistant ordered for X-ray. So far, no money was asked. Remember, no money was asked. Then they took an X-ray. I have an X-ray right now in my pocket, in my phone. It was a massive dislocation of his elbow. These two bones had dislocated completely. Chief emergency officer came. He talked to me. He said, I had to set it. I said, what will you do? Will you call an orthopedic surgeon? He said, no. I will not call the orthopedic surgeon. I'll do it myself. I'll set it here itself. Okay. Meanwhile, they said, you go and take your photo. Make sure you stick it on your coat because otherwise nobody will allow you to walk in the hospital. Then insurance department people came. They took my signature because I was attendant. Then I said, I want to talk to your wife. He said, no, she'll get scared. I said, no, that is not possible. I cannot allow you to go into a procedure in America when your wife does not know. I will talk to her. There is no question about it. He agreed. His wife was an anesthetist in Cochin. So multiple people came, insurance people, everything. Then emergency medical officer gave him some fentanyl. You know word fentanyl because of Trump you must be knowing, no? Are you aware of the word? Every day he shouts on TV, fentanyl is coming from China, fentanyl is coming from Mexico. Correct? If you take fentanyl yourself, you will feel good because I was given fentanyl 10 years back for a small surgery. So as soon as you are giving, you feel very good. There is no question about it, how people become drug addicts. So he gave fentanyl and reduced the fracture. Reduce means he relocated the entire joint in their own position. He did under fentanyl and then it dislocated again. Then he told me, I think I have to give him ketamine. I said, fine. But for adults, we normally don't use this ketamine. Bole, I have to knock him out. That means, I said, anyway, you're not going to operate? He said, no. So I told Abhi, don't worry, we'll operate also, I'll stay overnight with you. Don't worry about that. He's not my brother. He's from Cochin. So he gave ketamine. Insurance people came again took my signature 7th or 8th time. Then I got hypoglycemia because I also have mild diabetes. So I told the nurse, because I have a sensor all the time in my pocket, I can check sugar without punching my finger 24 hours a day. So I said, can you give me something? So that nurse brought me for a ham sandwich, which I don't eat, but she gave me honey biscuit and apple juice. So my sugar was, she did not charge me for that also. Then he came second time, they attached cardiac monitor and gave him ketamine, and then he reduced the fracture again, this dislocation. It set it right. But after that, they came for $300, which was minimum. Bill must have been $25,000. They said they'll deal with the insurance company for that. They just give a token amount, $300, which he took out the card. At the end of 2 hours, he said, you can go home. I realized that my friend is only 90% out, not 100%. He will not be able to go to his hotel on his own. So I asked the hospital to make the arrangement for taxi because I did not have an Ole app in my phone. If any of you go to America, make sure you got Ole on your phone. You are in trouble if you don't have. I was in trouble. But I say, Paramatma makes enough help all around me wherever I go. So I had no trouble. So I requested them that please arrange this help. They happily arranged the help. I told Abhi, come with me. We stood on the footpath outside the hospital. I realized my friend was still disoriented. He had not come out of ketamine. I asked his hotel address. First taxi which they ordered did not come. Then I went inside the hospital again. I told him, your first taxi does not come. Can you arrange the second taxi? They said, we'll do it for you. They arranged the second taxi. Came. I took him to his hotel. I said, do you recognize your hotel? Actually, he says, I don't. I smiled. I had already read his hotel address. I took him to the reception. This is my place. I said, go inside. His hand was in a sling. You know, sling is a help here. I said, don't take a bath for 3 days. He said, why? I said, if you sleep in the bathroom tomorrow, I'm leaving for India, you will fracture the other hand and you will not find Vivek Pathak now. And both the hands are gone. You will be like Jesus Christ like this. Both the hands gone. So make sure you don't take a bath. He said, fine. While I did all that, I missed my meeting for entire day. From 1:30 onwards till 7:30 I was with him. If he was operated also, I would have stayed overnight with him in the hospital to make sure he was stayed. If he had gone alone to the hospital, he would have been in massive trouble. First of all, I don't know how they would have discharged him from the hospital in 2 hours' time. Even if they discharged, how would have taken his taxi back to the hotel? He was unfit to call for a taxi. He would have been standing on the road like a drunken man, he not knowing where to go. This I did for him, knowing that he's not my family member. You know what he said, one statement? Dr. Pathak, I have got my 5 classmates here. I did not call any of them because they'll tell me how busy they are. They will not come. I said, how do you know I'll come? I know you will come. That's why I called you. This is what you should generate in life in others. This is called as compassion. Empathy, I could feel his pain. So whenever doctors, and this is an example I'm telling you, not for self-gratification, what we did around 5 weeks before in Houston. He was not my relation. And then my juniors know one thing. I strongly believe all our life is decided by the law of karma. So he sent me a message next day, I'm very grateful to you because you were with me all the time. I said, no, that was not your test. Since I am in a path of meditation for 28 years, this was my test by Krishna. He said, how do you know? I said, I will know in few days. Next day, I went to Houston airport. I had booked my ticket 4 months in advance. They said, doctor, can you stay here overnight? We'll make arrangement for a hotel. I think our flight is full. I said, nothing full. Sometimes you have to fight also. Don't worry. All the time you cannot be polite. So I said, no. I want ticket today. We will give you Houston to Doha ticket, but Doha to Mumbai ticket you will not get. I said, why? Flight overbooked. I said, that is your fault. Just to make sure you give ticket to your favorite passengers, you are not even asked me. Your computer did not allow the booking to happen. My travel agent is trying for 20 hours from Mumbai, and your computer is not permitting my the printing of my boarding pass because you got your favorite people for whom you issued the boarding pass, who might have booked the ticket much later than me. He could not say anything. But I can give only one boarding pass. That is from Houston to Doha. I said, give me that at least. I don't want to stay here. They gave me the boarding pass. They said they will come and help you at Doha. I know nobody will come and help me. I knew this. So one man in the aircraft, flight attendant, he spoke to me. I said, you also was in Malayali. It is Malayali day. My friend who fell was Malayali. The hospital people who helped me was Malayali. One nurse who came, oh, you are from India. You are from Coimbatore. Oh, she immediately gave me her telephone number. If you got any kind of help you require in the hospital, please call me. So I can tell you now, the example of American medical emergency system was fantastic. But the doctor who reduced the fracture told me, don't go inside the main hospital. That's terrible. Don't go into the main hospital. You will be totally confused. You will not know where to go. But American medical emergency, they did not ask money. They did not do any blood test. Nothing. Though I said they could have checked sugar. But they did not touch even sugar also. They did only the relevant thing. They were professional. They took the patient in 10 minutes. Did not pressurize for any kind of money. That's how the medical systems can be. It's not possible in our country because patients can also be ungrateful at times. But I gave you this example of what I went through. So anyhow, at Doha, they told me to go to some booth. They'll issue a ticket. Now I was in trouble. I was standing at a foreign airport without a boarding pass in my hand. I don't have the visa for Qatar. So I went to first booth. One lady was sitting in the booth, obviously after a fight with her husband. Her face was wrinkled like this. She must be fighting with her husband and sitting in the booth. Her face was totally gone. I said, I want boarding pass from Doha to Mumbai. I don't have boarding pass. I said, very nice. Then she sent me to 50 meters away to another Indian lady from Mumbai was sitting. She said, this lady could have given you boarding pass, but she has not given. No compassion in that lady in her profession that somebody requires help. I don't have a visa for Qatar. She could have given me the boarding pass, but she did not. So they sent me another 500 meters away to one more booth, self-helping booth. I call them unhelpful booth. There some Indians were sitting. So in Marathi there's the word apna manus, our own man. Immediately the Indian came to the rescue of Indian. I said, Krishna, do something now. I don't want to sit in this country anymore. So she looked at the computer. We have only one seat left. Whether you will get it. I said, you don't worry, I will get. Somebody at the higher level has already decided you are just nobody. Yeah, I will get it, don't worry. So I had to call to my sales team. I said, call your sales team. There's no problem about sales team. Sales team confirmed my ticket. I came back to Mumbai. So whatever I did one day before, translated into my help next day. Remember, all of us are interdependent. We are not individuals. We are interdependent. Third day for 7 years without sleeping. At the same time, you have to attend seminars, you have to attend general clubs. From 1990, when I joined this hospital in 2016, when I appointed somebody under me, I was on call 24 hours a day for 26 years. Ask anybody in this hospital. Okay, I may call 20 times in a month, but I don't have to come to hospital every time. Initially, first 7, 8 years I came, but at least your life is disturbed. So first principle I told you is, when you join this venture, you have to be successful. Second, it's an incomplete science. It's an art, not an engineering career. You should have empathy for patients. You should have compassion for patients. You'll get enormous blessings. You should have subject knowledge, which should be converted to wisdom. You should have clinical judgment. And after, if you follow all this, money you get, I call it pious money. I don't know whether you ever heard this word. I use this word pious money. Pious money is that which gives you and your family member peace. Impious money which comes to you, but you did not deserve it. God creates a hole in your pocket and it disappears. It will not stay with you. That is called as pious money. Now, before Corona, I was working 14 hours a day. And our chairman also was working for day and night. Neither he felt tired nor I felt tired. Why? Whenever somebody feels tired, I feel abnormal about that fellow. I said, why should he feel tired after working? A farmer works full day. He goes home singing. A clerk in a government office, he is irritated. If you go to a bank, his face will get angry when he looks at, oh, one more fellow has come. Because the job which he has taken is not his hobby. You should take a job which is your hobby. Nephrology and medicine is my hobby. I never get bored. I never get Monday morning blues. Oh, I have to come to hospital again. I'm happy coming to the hospital because I'll do something which I love from my heart. Nobody forces me. Only thing you should correct branch. For example, once I was standing in behind dialysis room. There was a small child. And the doctor who had referred the child to come that room, his name is Ashwath. He lifted child in his lap. Oh, darling, how are you? I realized I am not for this profession called pediatrics. I can't do what he did. I cannot do. So he is meant for that profession, pediatrics. I am not meant. Correct? Darling, how are you? Lifted, oh, mother, father, tears flowing down their cheeks. So he is a born pediatrician, which I am not. You should take a profession which is your hobby. I will tell you example of one of my seniors, whom I have not met now. He had 8 gold medals in the medical college. after that also that fellow was foolish. Why? He did not understand medical career at all. He took a branch in which he was not capable at all, surgery. And he was a miserable failure in life. Ultimately, he became a drug addict. Why? Because to become a surgeon, you require lion's heart, hawk's eyes, and lady's fingers. He lacked everything. He only ate gold medals show. He did not realize if blood comes out of the patient, he will also feel unconscious. Patient's pulse rate goes up, his pulse rate also will go up. Patient BP drops, his BP also will drop. So you should choose a branch in which you are fit. Whether it is psychiatry, or it's a nephrology, or it's cardiology, whether it becomes your hobby. If medical profession has been thrown on you by your parents, it is not our hobby, you will feel tired. And nowadays I don't work that much, only 10 hours a day. But yet I am not tired in the evening. When I go home, I am as fresh as morning 6 o'clock. There's nothing, because it's your hobby. Why clerk gets tired and farmer does not? Because tiredness is a mental thing. Your thoughts will consume you more than actual physical work. A player, Sachin Tendulkar, plays full day, and if he makes century 150 not out, he's so happy, excited, goes attend a party. While a clerk coming from the hospital, from anywhere, he's irritated. Again, I have to go tomorrow, because he is doing something which is not hobby. So develop medicine into your hobby, right? Get pious money in life. Work hard, convert knowledge into wisdom. Application of knowledge is wisdom. Just working hard will not give you success. A manual labor who works for construction of a home can work for full day, yet he will not get money. Money requires some intelligence also. Got my point? Now, I will talk for 10 minutes something which you would have never heard in life and never hear again in life. What is this intelligence? I have come to this word intelligence. When I was 17 years old, I was an atheist. When I got married, my father thought I will not go to marriage pandal because I had no faith in God. I thought it's a mental weakness for all human beings. I'm mentally very strong, so why should I have any faith in God? I had none. So I asked question, what is this God? I said, why do you worship him? Who has seen him? Nobody gave me any answer. I'll give you some answer from our Vedas. I don't know whether you can absorb it today. I can talk on this topic for a long time, but in 5 10 minutes I'll stop it. I will talk to you something which you would have never heard in life till date, and you will unlikely to hear, you are unlikely to read. How do our Vedas define this word God? How they talk about it? Because I have came to the word intelligence. Hard work alone does not pay. Intelligence required. And intelligence should be in the right direction. If you're crooked, you are getting impious money, and you will be getting all the troubles in life. So you have to collect pious money. You have to, all these qualities which I have defined you is little away from Boeing in manufacturing company. So when I started reading Vedas, the commentaries on Gita, everything, I wanted to understand this word, what it is. So rishis of India, rishis are those people who meditated and discovered that truth we call as God. Discovered. How? They looked at the soil. I'll tell you, these are all thousands of pages and rooms can be filled. I'll tell you what I can tell you in 10 minutes. They looked at the soil. This soil, how this soil can grow wheat also, rice also, and vegetables also. Soil is same. Same sodium, potassium, calcium, phosphorus. Nothing else is different. Then they looked at the plants. Soil does not respond, but plants do respond. Then they looked at animals. Animals are little better than plants. And then looked at humans, who are sometimes worse than animals. But look at their vision. They realize one thing, plants are little more intelligent than soil, little more conscious. So they say, God sleeps in soil, wakes up in plants, walks in animals, thinks in humans, and when thinking crosses, you think, he is yet God again. It is called as evolution of consciousness in Vedanta. Once I was standing in New Zealand in a rose garden with my wife. There were around 40,000 roses. I have got still photos with me. 40,000 I'm talking. So I asked the garden owner, I said, what do you give them? What kind of manure? Because I also have roses in my garden, nearly 400, but not 40,000. I got the instinct from that. So I said, what do you give them? Can any of you give me an answer? What did he say? I don't think. I said, what kind of cow dung, what kind of manure, what ammonium you give? He said something which is true, which you will not believe to be true. He said, I love these plants from my heart. I come and touch them every day. I come and pet them and they respond, which many gardeners have told me. Plants do respond. They're very, very responsive. They have life. So that's what Rishi said. Life starts in soil. Life is Paramatma or God. Suppose I look at you. Any student, suppose one girl Sandhya came. Can you see anything here? She will say, definitely I can see. If you can see, does it not establish vision? It establishes vision, no doubt anybody, no doubt, no? Suppose you can hear my talk, if mentally you are here, if mentally you are not at home, your physical body may be here, but mentally you can be at home. Mentally you may be fighting with mother or father. It's possible for not giving enough money. But then, if you are listening to me, does it not establish a sense of hearing? It establishes. If you put a beautiful, wonderful food which you like, medu vada, which I ate just now before coming to your room, does it not establish a sense of taste? It establishes. Are you conscious that you are listening to my lecture? Any doubt about that? No. That means, does it not establish consciousness? It does. And that is what Vedas call as Paramatma. That conscious presence in you is Paramatma. They say Shiva leaves the body, it becomes Shava. Shiva means Mahadev, the highest god which you worship. And Shava in Hindi or Sanskrit means a dead body. If you ask a dead body, Ramaswamy, how are you? Do you think Ramaswamy will respond? No. Because Ramaswamy, there is no conscious presence. While in all of you there is a conscious presence. That conscious presence makes you present here. And that is God according to Vedanta, which is present in every particle of this universe, every intelligence. So once I was talking to a neurologist who claimed consciousness arises from the brain. I said, don't talk to me like a layman. He said, why? I said, when you were in mother's uterus, first you were at the 2-cell stage, then you were 4-cell stage, 8-cell stage, and your development happened according to a programming where there's no brain. I said, do you think you were born with a brain? No. You were conceived without brain, brain formed 3 or 4 months later. How did your formation of body proceed in the correct direction? At the time, he had no answer. I said, that shows a pre-existing intelligence which allowed the formation of your body and brain according to instructions given at the higher level, so that entire cauliflower or sambar which you are eating, your brain, liver, heart, kidney is nothing but modified cauliflower or sambar or idli. It's nothing else. It is also called as Annamaya Kosha. Challenge me if you can. When you burn your body, cremate body, where do you go? Go back to the soil only, no? But there is something in the body which never dies, never dies, never dies. That something is God, according to Vedanta, which comes and goes and comes as good presence, who is present in you. So I said consciousness does not arise from your brain. It expresses through your brain like electricity expresses through the bulb as light. Light is only reflection. It is not the truth. Truth is electricity. If bulb is fused, put one finger inside the socket, you will know what is electricity. Correct? So God is like petrol in a car. Without petrol, car cannot run. But if you get drunk and hit the car at 120 kilometers with a telephone pole, is it the fault of petrol? No. So he's a conscious petrol in our body, and he allows us, that intelligence, infinite intelligence allows us to function this universe, which should be used with all your discrimination power, which is called as Vivek. Vivek means discrimination power, which allows you to do right things in life. Right things means you should act according to dharma. Dharma tells you what is right and what is wrong. When you know this patient is ill, if you're only interested in monetary, how much you will get out of it, that is not dharma. Dharma is to be on the right action. Lord Krishna says in Gita, non-violence is the greatest dharma. Then he also says, for the sake of dharma, if you commit violence like Arjuna did in Mahabharata, that is still greater dharma. So here your dharma is to do right duties for the patient according to intelligence which permits you. This intelligence allows you to function in this life. Without this intelligence, you are now nobody. But this intelligence should be used to this maximum. And your success in getting, what you will get after that, we don't know. All our destinies are different. Correct? 50 years back, chairman did not know he'll be sitting here owning a huge hospital like this. I have seen his journey. That is the result of Purjan Punya. I will not go into all that. I will not go into all that. So I'll say I am talking something. I use the word intelligence. I use the word we are interconnected. How? Look at your body. When you start running, Your lungs breathe faster. Why? You require more oxygen. Your heart beats faster because you have to pump more blood. Do you direct your heart to beat more? No. Do you direct your lungs to get more oxygen? No. It all happens because all the body cells are connected to each other. If you get a throat infection, white blood cells in your body run to that spot and make sure your throat is cured. But they don't kill you. It is a very selective form of intelligence. So they have no brain. Yet there is an intelligence which guides them to where to go. That intelligence in Vedanta is called as infinite level. It is called as the highest intelligence which permeates the entire universe. It's like a thread in a garland. It's like butter in milk, which is unseen but always present. You have to turn it out. So make sure you act according to dharma. You have compassion for patients. You work with empathy. Do not do a procedure of patient which is not justified for father or brother. That's my criteria. Yesterday, my assistants asked me to do a kidney biopsy. They wanted to go ahead. I said, no, this biopsy cannot be done. I said, this man is not completely, he's at a risk for biopsy, he may bleed. There are certain factors which you will not understand. I said, no, I will not permit this biopsy. Why? I said, this diagnosis which I'll get after biopsy is not so great. Biopsy is indicated if it's normal, but such a high-risk biopsy, if he falls sick, I will not do for my brother, so I will not do for my patient also. Simple. There cannot be two rules, one for the patient, one for your patient to get the money. No. Money will follow. Money, remember, I'll tell you one thing. Money follows excellence in life. Success can be academic, you publish a lot of papers. Success can be a mental peace, you are help others. Success can be an achievement in getting monetary success, which is only one part of success. Every success is only a flow of energy. So ultimately, how do you achieve success? You don't have to move from your chair. I never went and buttered any doctor in my life. Even today, I don't do it. I don't go and meet anybody in Coimbatore. And I don't meet anybody in a hospital also. I don't go out of the city. I don't write any letter to doctors. Then how success comes? I follow these principles, but something higher level, after doing dharma and all those things. If you can attain a still mind in meditation, which I have attained, quite often I don't know who's on my right side, who's on my left side walking. If in that still mind, you put a seed of thought, what you want in life, you will get it. I don't know whether you can do it, I have done it. I have not moved from my chair in my life to ask patience from anybody in my life, and yet I had a reasonable success in my life. Correct? That you can attain by meditation, by a still mind, in which quite often my minds, there are no thoughts, nothing. My pulse rate remains around 42, 43. Cardiologist got scared. He did Holter monitoring for me last week. He found control now. Why? Because there are no storms in my mind. No storms. Even if it's cold mildly, some technicians or nurses, mind remains in stillness. That comes from meditation. And that still mind is a very powerful mind. If you think something, it will happen. It will happen. And you can achieve success without bothering anything. But it will only come, otherwise you have followed the path of dharma. If you have followed what is right, if you want to be of any use to the patients, if you don't follow the remaining things, if you're not following the path of dharma, truth, compassion, then success will not come. Even if it comes, your life will be in trouble. So be successful in life because that will make you happy. Success will differ according to whatever you can. So what you can do is a successful effort. Destination is not a wonderful. Like Krishna says in Gita, whatever you get in life is what I will decide. You can do what you want to do. So all of you, I wish, be successful in life, be happy in life. Follow the path of dharma and medicine. Thank you.
Thank you, sir, for your insightful and encouraging words. Thank you, sir, for your insightful and encouraging words. As we have come to the end of this memorable white coat ceremony, we call upon Dr. Vijayanand, Head of Department of Anatomy, to deliver the vote of thanks. Sir is proficient in guiding students to achieve excellent university results in anatomy. Over to you, sir.
Good morning to all. On behalf of this prestigious institution, I am truly honored to deliver a vote of thanks on this memorable day for a special and significant occasion, the white coat ceremony for Phase 1 MBBS students 2025 batch of Kmch Institute of Health Sciences and Research, Coimbatore. First and foremost, I extend my heartfelt gratitude to our chief guest, Dr. Vivek Pathak sir, a renowned nephrologist in Kovai Medical Center and Hospital, Coimbatore, for delivering inspiring words to the budding medicos and grace the occasion in spite of this busy schedule. Sir, your insights on compassion, responsibility, and ethics will remain in them throughout their career. Thank you, sir. I now thank our beloved chairman, Dr. Nallaji Palaniswamy sir, whose visionary leadership and unwavering commitment to excellence continue to shape this institution a center of academic brilliance and compassionate medical training. Sir, you are always a true, inspiring leader and a role model to all of us. Thank you, sir. Next, I thank our Executive Director, Dr. Arun N. Palaniswamy, sir, whose dynamic leadership and youthful vision continue to inspire each and every student and faculty member of this institution. Thank you, sir, for carrying forward the legacy of excellence with remarkable dedication, humility, and passion. My sincere thanks to Chief Executive Director, Mr. Karthikeyan, sir, Dean Administration, Major General Dr. Ravi Kumar, sir, Dean Academics, Dr. Sridhar, sir, Medical Superintendent, Dr. Ram Kumar, sir, Vice Principal, Dr. Jeevithan, sir, and on-faculty members who work tirelessly in shaping the cognitive, psychomotor, and attitude domains of every student who walks through these halls. Your hard work and dedication forms the backbone for this institution. Thank you all, sir. I thank each and every parent and their family members for giving unwavering support and encouragement to their wards. It's all your dedication and sacrifices have brought them here to this proud moment. I also thank the entire organizing team and all supporting staffs who stood behind the scenes and made today's event remarkable. Last but not the least, I congratulate and thank every student on receiving your white coat. Wear them with pride, humility, and integrity. Make this ceremony mark the beginning of a wonderful journey filled with joy, happiness, learning, compassion, and excellence. Once again, I thank each and everyone from the bottom of my heart for making this historical event a grand success. Thank you. Have a wonderful day.
Thank you, sir. I request everyone to please rise up for the national anthem.